Hi, and welcome to a CUNY TV virtual town hall, COVID-19 vaccines, myths and misconceptions. I'm Mike Gilliam. There's a lot of misinformation swirling around the COVID-19 vaccines, and it may be leading to vaccine hesitancy, which could slow down the battle to stop the pandemic. In the US, the main vaccines are made by Pfizer, BioNTech, Moderna, and Johnson & Johnson. And as of this taping, about 18% of the American population has been fully vaccinated. But to get the country fully back to normal, science and health leaders agree almost everybody needs to get immunized. And what is one of the main roadblocks to this now that the vaccine rollout is fully ramped up? Simple misinformation. According to a recent Pew Research poll, almost 30% of Americans say they do not plan on getting or will not get the vaccine. The reasons vary, from myths spread by hardline anti-vaxxers to, in the Black community, a distrust based on prior government experiments on African Americans, like the Tuskegee experiments from decades ago. But much of the reluctance is a result of what is called vaccine hesitancy, in part a sense that the vaccine research and development was rushed and is unsafe. There are also community biases as well, with racial inequalities being seen in vaccination rates. And on top of that, recent studies show that white evangelicals are the latest group to say they will not get the jab. Here at the university, we're trying to help by launching #VaxUpCUNY. It's a multimedia campaign to encourage students, alumni, faculty, and staff to get the vaccination. So, where do we stand on getting most New Yorkers and Americans vaccinated? And how can science help to overcome hesitancy and bring an end to this horrible pandemic that has claimed so many lives? We have a great panel for our discussion, including Scott Ratzan, the executive director of Convince USA, a national group housed at CUNY, whose goal is to support immunization and the science behind it. Arva Rice, the president and CEO of the New York Urban League, and a member of a panel dedicated to addressing the concerns of Black New Yorkers about the vaccine safety. And Jitendra Barmecha, an associate professor at the CUNY School of Medicine. Welcome to all of you. Scott, let's start with you. Where do we stand now? Are we almost out of this?
Well, Mike, thank you for that great introduction. And let's say that we are very clearly not out of the woods yet. We're right at the beginning of the forest. And if we just think where we were a year ago, this week, over 5,000 New Yorkers died from COVID. A year later, we have a vaccine, but we have a real job to do to get everyone vaccinated. As you stated, you just have 18% of the population currently, but many other people are online and wanting to get vaccinated quickly. The issue that you mentioned, however, is not getting the first 50% or half of the people vaccinated, but the next 50% is going to be the bigger challenge. At CUNY School of Public Health, we've been working on this tracking survey since the beginning of the epidemic, initially in March last year. And since that time, we have continued to track New Yorkers and other people willingness to get a vaccine. And unfortunately, let's just say that there still is a large number that are hesitant, but we remain optimistic, as you mentioned, with #VaxUpCUNY, as well as a variety of other activities. We will be able to get the necessary numbers to achieve what we call in public health herd immunity.
Arva, there's also a political aspect to all of this, with many Republican men, white men, saying they won't take the vaccine. Concerns on your part about all of that?
I do think that there is an issue around hesitancy, and the hesitancy movement is growing with those folks who support Trump and others, as you outlined. But I also want to make sure that we don't forget that there still are some issues around access. The fact that you can get your vaccine through basically a computerized program creates some problems in our communities for those who still don't have the level of computer access as others. And so we are still at the New York Urban League, still working with seniors in order to help them to be able to get appointments and be able to get transportation in order to get their vaccine. So I do have some concerns about those who are hesitant. I do have some concerns, as you mentioned, about the last and the next 50%, but we want to make sure that the first 50%, those who are still trying to get access, still have the resources that they need.
Mm-hmm. Jitendra, some women are also balking at taking the vaccination. Talk to me about that a little bit.
any childbearing age women or any female above 18 years old should receive these vaccines. Especially if you are trying to become pregnant. It is safe based on the American College of Obstetrician and Gynecology recommendations, which was recently released. They had over 30,000 women who were pregnant in their registry. And it's not only protecting the new moms, but also the antibodies are passed through the placenta, and it will help the fetus and the newborns. The other good thing is it is also passed through the lactation or the breast milk. So your newborns are safe. And based on the current knowledge and evidence we have, I think anybody who is above 18, all women should receive this vaccine.
But isn't one of the main concerns among women a thing where they're concerned about infertility and whether or not they'd be able to conceive after getting this vaccine?
To my knowledge and the what we evidence we have so far, we have not learned about this issue. And as far as the evidence, people are taking it, and I think there are only two options: either you get infection or you get vaccine. And I'm sure most of my colleagues, including me, my wife, and my daughter, they all chose to take the vaccine.
Yeah, you made that very clear there. I think that that is your real choice there. And a lot of people, when they frame it like that, it becomes an easier decision. Scott, let's talk about Convince USA. What is it, and what is it trying to accomplish?
Sure, Mike. We have identified vaccine hesitancy as the issue that Arva and others have mentioned quite some time ago. The World Health Organization put this forward as one of the top 10 threats even before COVID hit in 2019. So we've been studying and writing about that in the specific nature, even with measles. And when COVID hit, we started these surveys, and along with Heidi Larson, who's been the founder of the Vaccine Confidence Initiative out of the UK, we put together CONVINCE, which stands for COVID New Vaccine Information, Communication, and Engagement. And we know what that means is that we not only need to give people information to make decisions, but communicate appropriately. And as others, Arva has already mentioned, we need to do this in an equitable frame to engage communities. So we've come up with Convince USA at CUNY to advance vaccine literacy. Literacy at the level of all of society. So policymakers put the right policies in place, whether they're school-based policies, whether they're workplace-based policies, or even good public policy to get people the information to get vaccinated, for equitable access, for the ability to get it at places where they can trust, whether it's a physician's office, a pharmacy, a hospital, a community health center, a church, and so forth. So that's what we've been focusing on, the messages, the right trustworthy sources, and the ways to work with communities to help get everyone vaccinated and address COVID, because this is going to be a new normal that we're going to have to live with. And the questions that you've asked about booster shots and all the other health issues will continue to come up. So we need to have the trusted sources and the trusted link. And that's what we're trying to do with Convince USA and CUNY School of Public Health, with a variety of other professors, graduate students, and associates with this program.
So I have a question on that, though. Why is that a better approach than if, in fact, you stuck a NFL player up there or something like that? Because if I see the NFL player say, I got the shot, and now I'm running for touchdowns and stuff, I would think, well, okay, that is safe. But you're saying that we need to get to a different level as far as getting people to trust the vaccine, correct?
I would say it's not a better approach. It's an all-encompassing approach. We need all NBA players to say that they're getting vaccinated. We need all church leaders and others in all different parts of the communities, teachers, principals, and so forth. So we're not identifying any one group as the one that everybody should follow. And our surveys show that the government is not the one that should be giving this messages. It needs to come from the community. It needs to come from people we can trust. It needs to come from doctors and nurses and other health workers. And our our community. So that's how we're trying to help foster that. It would be great for the NBA, and I think they've already said this, if 85% of their team is vaccinated, they can stop wearing the mask. Well, we need to get all those teams vaccinated. Same with the NFL, same with our high school sports teams. So I think we're going to continue to see that evolve. And right now, I think, as Evra mentioned, some of the issue is still access. But in a month from now, we're going to have enough vaccines. We need to aim for when school starts in September that 80% of students and faculty and staff and people that work in those institutions are vaccinated.
Arva, is that kind of the approach that you're working with the Urban League?
I couldn't agree with Scott's comments more. It is so important for us to have trusted members of our community who are involved in taking the vaccine and posting it, putting on social media. I just took it, showing their arm, showing their card. Some of the things that we're doing at the New York Urban League, which you already mentioned, is working in collaboration with Roll Up Your Sleeves New York. And so we were part of a collaboration with Governor Cuomo a couple of days ago talking about that. It is led by Reverend Al Sharpton, our national leader, Mark Moriel, and Jennifer Jones Austin at the Federation of Protestant Welfare Agencies. And so we've developed a toolkit that really talks about all of the issues that we're speaking about today, the historical issues that African Americans have around healthcare. And it's not only going back to the Tuskegee experiment, which is something that very much lives on in our history, but it actually goes back to going to the doctor yesterday, right? So there are inequities that exist in the healthcare system that African Americans feel on a day-to-day basis, right? So it's interacting with a system that they sometimes feel like wasn't built for us. And so in addition to some of the strategies that Scott was talking about, we're doing all of those and then also bringing medical professionals of color. So doctors and nurses onto town halls, having direct conversation with our community members saying, this is how vaccines are developed. This is how it was developed in this case. These are some of the reasons why we think you should consider it. Just be educated about it. Of course, we hope that the decision in the end is that you do it, but in the meantime, we want to make sure that you have as much education on this as possible.
Jitendra, you kind of agree with what she's saying, right?
Absolutely. Education is key and finding the access. So just from the provider perspective, when Pfizer, which was the first one, came out, there were several challenges on the supply chain as well as the storage, and also scheduling those two doses within 3 weeks. Now, as Scott mentioned in the opening remarks, we have 3 vaccines now. We can Moderna, Pfizer, and as well as Janssen, the Janssen is the best one. Actually, you just take a single dose. You don't have to come back for 3 weeks or 4 weeks. The storage is not an issue. So as the time has passed, we are getting better supply chain issues, better storage issues, and better access issues. But to Arva's point, I agree completely. I practice in the Bronx. There are several challenges on the scheduling. I think with the time, in weeks or coming days, it's only going to get better.
Okay, great. There are very good points that were made there. We're going to take a quick break, and when we come back, we'll look at vaccine hesitancy, including what's happening in the Black and Latino communities. Stay with us. Welcome back to our CUNY TV virtual town hall, COVID-19 vaccines, myths and misconceptions. I'm Mike Gilliam. Now, one of the major concerns surrounding the vaccines has been the hesitancy some have to taking the jab. It puts herd immunity at risk, and some people are not embracing the vaccine for a number of reasons.
Despite having gotten COVID, losing a coworker and an uncle to the virus, Cassandra Irizarry says she's not getting the vaccine anytime soon.
Despite all of that, I still am very uncertain, and I am fearful of taking this vaccine, despite everything that's happened. Most of it is because I don't feel comfortable with how fast the vaccine became available to everyone. And the other piece of it is the long-term effects.
Scott, how serious is the problem of vaccine hesitancy, especially in the hard-hit communities of color?
Well, this is a real issue in terms of vaccine hesitancy, but it is something that I believe we can overcome. Now, as I mentioned earlier, we have been conducting surveys in New York, and in February, we had a very specific one on vaccine hesitancy and confidence in Harlem. And what we found is that a number of people, actually most people want to take the vaccine. It just was not available in February, which is different than they're hesitant. Some of them are neutral, some of them didn't even know that the vaccine existed. And it's up to us, the imperative, to make sure that the community has access and we're able to give them the messages to help them get the vaccine. We have found that many people at different ages are more interested in getting the vaccine to protect themselves. Those, frankly, are the older population that are more worried specifically about dying from COVID, versus the younger population that's more interested in doing it for their community. So that means we need multiple messages that we're working in concert with the city, with, as Arva mentioned earlier, all the different opportunities to work with community groups at different levels. That's, I think, what we need to do. It's a serious issue, but rather than look at it negatively with the glass half full, we need to look at the glass that we could fill up and build vaccine confidence. And I think it can be done.
Arva, what are you seeing? I know you mentioned the task force that's been created. What are you guys seeing?
First of all, I wanted to acknowledge what Scott just did, because that's exactly what we need to do around vaccine hesitancy. The very first thing that he did was acknowledge it. Right. So he acknowledged it, then he spoke from there. I think sometimes we jump into to say, well, the vaccine was done in this, like, and we just jumping to convince. And the fact is that people have hesitancy for very real reasons. And so we need to just take a moment and accept that, right? And then move from there. Being able to hear from people why they're hesitant, what their issues are, and then be able to speak from that. And so I think that that's something that's really important. And so that's the reason why it's important to have town halls that are interactive, where people can chat, where the Zoom room is open, and so people can ask their questions, and be able to realize, wait a minute, that's a question that I had too. You know, what is the difference between these various vaccines? You know, what makes the J&J? You know, how can they do it in just one shot versus having to do it in 2 shots? Being able to ask every single question that they need and want in order to move them from that place, because I think that the more and more people that they can hear about, that they can interact with, they can tell their stories. My arm hurt for a minute. My arm didn't hurt at all. I was a little bit sick, but 3 days later, I was better. I never went to the hospital, which is the other alternative if you have COVID. So I think that being able to share those stories is going to help us to get to the other side.
But what do you hear most often when people are hesitant?
Oh, that's a great question. I think that people are hesitant because they, you know, all the things that you talked about, that they think that the drug came to market very quickly. There are some people that believe that one drug is better than the other, and they're just not telling us, right? So that they're pushing one drug in the Black community, where in other places, and we're going to find out 5 or 10 years from now that there's something wrong with my arm or leg or my head as a result of this vaccine that wasn't fully tested. I think that there's some people that are, you know, that are kind of Governor Cuomo referred to it as superheroes. They think, you know what, I'm good. I'll be able to push through it, whether I get COVID or whether I get the vaccine. I'm good. I can just kind of push through. And
It's like the flu.
Exactly. And I think that people need to hear that message that Scott was talking about, that some people will ultimately make the decision to do it because of a community member, because of their grandma, because of somebody in their families. And then there's other people that are going to do it because of, you know, for medical reasons and that sort of thing. So it's important to give those different messages.
Jitendra, are you seeing some of those same things?
A little bit different since we are in the healthcare provider environment. So when Pfizer received the approval on December 14th, and we received our first batch on December 17th, and I received it on December 18th. So one of the most common hesitancy amongst the healthcare workers was the immediate side effects or the side effects, because it was these were manufactured in the warp speed of like close to 8 to 10 months, but these were tested in over 40,000 individuals before the FDA gave the EUA approval. And people didn't want to get sick during the holiday time. So that was our biggest hesitancy in the healthcare worker. But I think by and large, the side effects, which are some of them are immediate and some of them are a little bit delayed by few hours or a number of days, are the biggest
Talking
hesitancy.
about like COVID arm and rashes. And
Exactly. And the second one is the whether they will alter the DNA or not, because most of the healthcare workers are educated and they feel that this messenger RNA vaccine by Pfizer or Moderna will alter their DNA. That's not absolutely true, because DNA resides in the nucleus, whereas these vaccines are made of messenger RNA. It doesn't even touch the DNA. And the other ones are like, do I still get COVID even if I get a vaccine? Yes, we can get infection, but the severity will be very minimal or even insignificant based on the last 6 months or 8 months studies we have so far. So yes, I completely agree with Scott and Arva, the hesitancy, different questions. I wish we had FAQs by Alexa or Siri or Google, that any question you ask, they get the answers right away. That, hey, Alexa, is there any side effect of this vaccine? So you get the right away the answer. I think more we come out in the community, more questions are answered. I think people will feel comfortable.
There's also controversy swirling around another aspect of this. Okay, so say we're all getting people vaccinated and doing very well with that effort. What about the idea of being able to prove that you have been vaccinated so that you can take part in society, whether it be going to an arena, a stadium, or whether it be going to your local restaurants? I'm talking about vaccine passports. Good idea, Jitendra?
Absolutely. I just downloaded from the New York State Department of Health for travels, for going to any large organization or sports events. I think it's good to have, and we'll continue to see these kind of requirements in coming days or weeks or months.
Arva, where do you come down on that?
Yeah, I am a big proponent of passports as well. I think it's important, particularly in places like New York City, highly populated areas. I want to be able to go back to a Knicks game, but I think that I'm not going to feel comfortable doing that unless I know that the other people in the arena are protected. And so I think that this is a decision that people should be making not only for themselves but for others. And I have great concern with governors in other states in the South that are saying that they're standing up and against the idea of the passport.
Scott, what do you think of the idea of getting?
Well, I certainly would like to know, and I would like to have society fully vaccinated for sure. That's a goal. I don't think right now that the passport discussion should get in the way of getting people vaccinated. And I fear that's what's happening. 11% of Americans do not have a government issued ID. And we might think everybody can download something and have an app, but many don't have smartphones. Many don't even have phone numbers. We have to be very careful on equity here, on giving people access or in the potential of having prejudicial behavior based solely upon vaccination. I know some of these also have the opportunity to test, so you could get a test, and then it also gives you clearance. There's lots of pieces that have been done in different parts. New York has this Excelsior Pass idea. There's a Commons Pass one. Israel's had some success with a green passport. I think we just need a lot of discussion and get people vaccinated first, and hopefully we'll get to that number that we would then have the confidence that we could get on an airplane or a train or go to a restaurant with some semblance of a passport or credentialing.
So what about the way the Biden administration is handling that? They seem to be hands off. They do not want to come out. Do you think that's because they don't want that to interfere with the messaging as far as getting people vaccinated?
Well, I think, Andy Slavitt was pretty clear with Drs. Fauci and Walensky behind him, saying that federal government will not get involved with this. This is up to the private sector. That's okay. At the same time, we don't have mandates for workplace, and maybe we never should have those. So we've got to figure out the right legal approach and the right approach to get people to opt in. I think that would be great to do it that way. That's my feeling right now. I think we need a great campaign to get people vaccinated and to focus on that at the levels that we've all spoken about on your show here today, Mike.
What do you think would be most effective to both get people to take the vaccination so that they can take part in society, but also so that those who have already have it feel safe?
I don't think we need to endorse any of them yet, but we need to figure out ways of voluntary certification. Just like in New York City, you can go to a restaurant and see an A for if it's met health standards. Maybe we're going to have some of this for if you're going to a theater, that you know everyone who's been vaccinated who's working there, or at least is tested negative on that time. So I think we need to think this through. I wouldn't rush to have everybody sign up to anything that could really have inequitable separation of people and not have the right access to their livelihoods as well. So I think the discussion, and that's what's been great, we've been focusing on vaccine hesitancy and building confidence. How can we do that all together and forge this through a partnership and forge this through the dialogue that we've been speaking about here today?
Well, that'll have to be the last word, but great conversation. Now, I hope it's dispelled some of the misinformation that's out there and prompts everyone to get vaccinated for not only yourselves, but for the community. I want to thank our guests, Scott Ratzan, the Executive Director of Convince USA, a national group housed at CUNY, Arva Rice, the President and CEO of the New York Urban League, and a member of a panel dedicated to addressing the concerns of Black New Yorkers about the vaccine safety, and Jitendra Barmecha, an associate professor at the CUNY School of Medicine. Thank you all for taking part in our CUNY TV virtual town hall, COVID-19 Vaccines, Myths and Misconceptions. I'm Mike Gilliam. Thanks for joining us.